Hello everyone, my name is Manisha Bhatane, roll number 4, studying in final year B Pharmacy from Shivajirao S. Zundre College of Pharmacy, Asanga. Today I am here to discuss about the anti-cancer agent under the guidance by Dr. Nitin Moire sir. So first basic question is what is cancer? So cancer is the uncontrolled growth of abnormal cell in the body. Cancer develop when our body functions stop working, old cell do not die and instead grow out of a control, forming new and abnormal cell. This extra cell may form a mass of a tissue called a tumor. So tumor has a two type, benign tumor and malignant tumor. So benign tumor is encapsulated, non-invasive, limited growth and regular surface. Malignant tumor has not encapsulated, invasive, uncontrolled growth, irregular surface. Development of cancer. Carcinogenesis is the process by which normal cells are transformed into the cancer cell. Here are three stages: initiation, promotion and progression. Initiation is the first stage. It involves the initiation of genetic changes within a normal cell, typically caused by mutation in DNA. Mutation means change in DNA sequence. This mutation can be triggered by the exposure to carcinogen such as tobacco, radiation and certain chemicals. The initiated cell gains the potential to become cancerous, but it does not yet exhibit uncontrolled growth. Second stage is promotion. In this stage, promoter encourage the initiated cell to divide and replicate more rapidly than normal cell. Promoter can be hormonal, chemical or environmental factors. Final stage is progression. In this, transformation of a pre-neoplastic cell into malignant tumor. This stage involves the further genetic mutation, including a alternation in gene that regulate a cell cycle, apoptosis, and DNA repair mechanism. Cells in the tumor continue to divide uncontrollably, acquiring characteristics that enable them to invade surrounding tissue and potentially spread to distant sites. Classification of cancer. So here are some classification: carcinoma, sarcoma, leukemia, lymphoma and myeloma and central nervous system cancer. So first is carcinoma. This cancer is started in skin or tissue that line or cover internal organ. Second one is sarcoma. This cancer is started in bone, cartilage, fat, muscle and other connective and supportive tissue. Third one is a leukemia. In this cancer are started in blood forming tissue such as a bone marrow. Lymphoma and myeloma. In that cancer are started in cell of a human system. Central nervous system cancer. In this cancer are started in tissues of the brain and the spinal cord. Here are some causes and symptoms of cancer. A carcinogen is a substance, organism or agent which are responsible for the cancer. Physical carcinogen, chemical carcinogen, biological carcinogen. This is some causes and symptoms of cancer are significant weight loss, poor appetite, excessive sweating, severe pain, neurological symptoms, change in appearance, blood in vomiting, chronic cough, bowel changes and fever. Treatment of cancer. So here are some various treatment for cancer: surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, hyperthermia, stem cells transplant, photodynamic therapy and laser in cancer treatment. Come to the main point, that is anti-cancer agents. So anti-cancer are those agents which are used to treat cancer. So anti-cancer is also known as an antineoplastic drug, chemotherapy, chemocytotoxic or hazardous drug. The anti-cancer drugs either kill cancer cell or modify their structure. They generally attack to the DNA and metabolic site which are essential for the DNA replication. Ideally, this anti-cancer drug should interfere only with the cellular processes that are unique to malignant cells. Classification of anti-cancer. So today we are discuss about four main classes, that is alkylating agent, antimetaboloid, natural products and antibiotic. Here are some other classification also, that is enzyme, miscellaneous drugs, hormones and radioactive isotopes. Cell cycle of anti-cancer drugs. So this is a 16-hour cell cycle. In that four phases are there: G1 phase, S phase, G2 phase and M phase. G1 phase is also known as a pre-synthetic phase in that synthesis of enzyme and the other cellular component which are needed for the DNA synthesis. Second one is S phase, that is synthetic phase, in that DNA synthesis takes place. G2 phase, pre-mitotic phase, in this synthesis of cellular component of mitosis take place. And finally is the M phase, in that mitotic cell division take place. So first main class is alkylating agent. Alkylating agents show cytotoxic and radiomimetic action. Many of these agents act on dividing and resting cell and thus are cell non-specific. Some of these agents show CNS stimulant and cholinergic property. Alkylating agents are chemically reactive compound. These combine most easily with nucleophilic center and fully saturated carbon atom of the alkylating group attached to the nucleophile. Mechanism of action. So alkylating agent produce carbonium ion which are highly reactive. Alkylating agent transfer alkyl group to the nucleophilic site of a DNA base, result in cross linkage, abnormal base pairing, DNA strand breaking, result in decrease in cell proliferation. Alkylation also damage RNA and protein. Classification of alkylating agent: nitrogenous mustard, ethylamine, alkylating alkyl sulfonate, nitrosourea, and triazine. Chlorothamine. Miclorothamine fall under the category of nitrogen mustard alkylating agent. So here are IUPAC name. Molecular formula is C5H11Cl2N. Molecular weight is 156.05 gram per mole. SAR is 2-chloroethyl group is essential for activity. Replacement of a sulfur atom by nitrogen will lower the toxicity. Aromatic reintroduction will increase the stability of the drug. MOA, it damages DNA via formation of cross-link. It prevents DNA synthesis and RNA transcription by attachment of alkyl group to the DNA bases. Then mispairing of nucleotide leading to mutation. So here are some uses: Hodgkin's disease, lymphosarcoma, and prostatic cancer. Side effects are loss of appetite, dizziness, and diarrhea. Adverse effects are vomiting and bone marrow. Brand name is Mustargen. Dose are IV dosage 6 to 11 mg per m square. Company name is Mark and Company. Second class is antimetabloids. Antimetabloids are the drugs that interfere with one or more enzyme or their reaction that are necessary for the DNA synthesis. These are those drugs which are used in a cancer chemotherapy. Cancer cell divide more rapidly than the normal cell. So antimetabloid affect cancer cell replication more than they affect normal cell replication. Generally, antimetabloid induce cell death during the S phase of a cell growth when incorporated into RNA and DNA or inhibit enzymes which are required for the nucleic acid production. Mechanism of action: they act by inhibiting the enzyme which are required for the folic acid regeneration or pyrimidine or purine activation of a DNA or RNA synthesis in neoplastic cell. They generally block the dihydrofolate reductase enzyme which are required for the DNA synthesis. Classification of antimetabloid: folate antagonist, purine antagonist, and pyrimidine antagonist. Drug is methotrexate. These are fall under the category of folate antagonist antimetabloid. IUPAC name. Then molecular formula is C20H22N8O5. Molecular weight is 454.44 gram per mole. SAR is thiourea intensity can increase the activity of the drug. Methotrexate contains dihydrofolate moiety which are essential for the interaction with DHFR. Then combination of this drug with a copper metal can increase the activity of the drug. MOA is methotrexate inhibit dihydrofolate, dihydrofolate reductase enzyme, which are required for the tetrahydrofluoric acid. So ultimately, the formation of a tetrahydrofluoric acid prevented. Therefore, DNA synthesis is stopped. Uses acute lymphoblastic leukemia and breast cancer. Side effects are weight loss, fever, jaundice, and shortness of breath. Adverse effects are mucosal ulcer and loss of appetite. Brand name is Otezup Resuo. Dose are IV dosage 20 to 100 mg per m square. Company name is Antares Pharma. Second drug is 5-fluorouracil. It comes under the category of a pyrimidine antagonist antimetaboloid. Molecular formula is C4H3FN2O2. Molecular weight is 130.078 gram per mole. SAR, the presence of a fluorine atom at position 5th is essential for the drug activity. The uracil ring is important in this structure. The substitution or modification on uracil ring may reduce or diminish the drug's activity. MOA is 5-fluorouracil activates fluorodeoxyuridine monophosphate, result in inhibit thymidylate synthase, depletion of a deoxythymidine monophosphate. Finally, apoptosis occur. Uses are corneal, renal, and rectal cancer, GIT cancers. Side effects are diarrhea, nausea, and mouth sores. Adverse effects are altered mental status and confusion. Brand name is Fluoroflex Tolac. Dose is IV dosage 300 to 600 mg per m square. Company name is Tokyo Chemical Industry India Private Limited. Third class is natural products. Herbal medicine are important in prevention and treatment of a cancer. Drugs which are derived from the plant, they have a less or no side effect. Cancer cells are susceptible to chemotherapy drug, but it lead to different type of toxicities in the body. To avoid this problem, nowadays various therapy for the treatment of cancer use plant derived products. Mechanism of action: in this, some drugs or agent block the topoisomerase function, which are essential for the cell replication, and some agent inhibit the function of microtubules, which are essential for the cell division. Classification of natural products: vinca alkaloid, epipodophylotoxin, taxane, and captogenic derivatives. Drug is vincristine. So this is come under the category of vinca alkaloid. Molecular formula is C46, H56, and 4O10. Molecular weight is 825 gram per mole. SAR is aryl or heteroaryl compound decrease the activity of the drug. Strongly polar or a charged group also decrease the activity of the drug. Decreasing the charge on the substituent also increase the activity of analogs of the drug. MOA is vincristine binds the beta tubulin, disruption of mitotic spindle, chromosome fail to move apart during mitosis, metaphase arrested, and cell division is inhibited. Uses are acute leukemia, brain tumors, some blood disorders. Side effects are hair loss, constipation, low blood count. Adverse effects are neurotoxicity, mouth ulcer. Brand name is Oncovin, Vincres. Dose is IV dosage 1.4 mg per m square. Company name is Taxane Healthcare Private Limited. Vinblastine, it is also come under the vinca alkaloid. Molecular formula is C46H58 and 4O9. Molecular weight is 811 gram per mole. SAR is similar as a vincristine. MOA is also similar as a vincristine. They arrest the metaphase, So result in cell division is inhibited. Uses: testicular cancer, lung cancer, germ cell tumor. Side effects are fatigue, weakness, constipation and diarrhea. Adverse effects are loss of appetite, nausea and vomiting. Brand name is Velpan. Dose: IV dosage 3.7 to 18.5 mg per m square. Company name is Cipla. Paclitaxel. These are come under the category of the Taxane. Molecular formula is C47H51NO14. Molecular weight is 853.906 gram per mole. SAR is: Taxane ring are essential for activity. Oxetane ring essential for the activity. OH is helpful but is not essential. MO is: paclitaxel bind to the beta tubulin, result in stabilize the microtubules which are essential for the cell division, so inhibit the mitosis. Uses are breast cancer, ovarian cancer. Side effects are blurred vision, fever or chills. Adverse effects are nausea, hair loss and neuropathy. Brand name are Taxol. Dose: IV dosage 135 to 175 mg per m square. Company name is Getwell Pharmaceuticals. Fourth class is antibiotic. Antibiotic has been recently recognized as an important class of antineoplastic agent. Antibiotic act by binding to the DNA or fitting into the helical lattice between a specific bases, thus blocking of transcription of new RNA and DNA and cell replication. They bind to the primary and metastatic cancer cell to inhibit the growth of the cancer cell and limiting the effect of a surrounding healthy cell. They are also known as an anti-tumor or anti-cancer antibiotic, and it can be also used to treat or prevent infection which are causes due to the cancer treatment. Mechanism are: anti-tumor antibiotic interfere with the DNA. They induce the DNA damage in cancer cell, inhibit the DNA replication and cell division, trigger apoptosis, and result in inhibit the tumor growth and spread. Is doxorubicin. These are come under the category of anthracyclic antibiotic cytotoxic drug. Molecular formula is C27 H29 NO11. Molecular weight is 543.52 gram per mole. This is a SAR. In that, hydroxyl group is helpful but it's not essential. Then sugar moiety is necessary. Then replacement of NH2, it reduces the activity. Then methoxy group is essential for the activity. MOR, doxorubicin inhibit the topoisomerase 2 which are essential for the DNA replication. So ultimately cell growth stops. Uses: thyroid cancer, uterine sarcoma and liver cancer. Side effects are nausea, vomiting, nail darkening and skin darkening. Adverse effects are fatigue, oral sore. Brand name is Doxil, Myosate. Dose are IV dosage 60 to 75 mg per m square. Company name is Gatewell Pharmaceuticals. So here are some reference.
We are thankful to our Dr. Shivajirao S. Jondre sir, Honorable Geeta Jondre ma'am and Nitin C. Moire sir.